All right. Um, Happy Sunday to my people, my viewers. Today is the first day of the week, and it's good to start the week with the right information that will make you healthy. And so I'm going to talk about health. But today, I'm going to be concentrating on what the definition of health is. I'm sure if you ask what definition of health is, you will say the state of being healthy. Some will say being physically healthy, or state of not being ill. Some will define it as a state of physical well-being. Um, these definitions are not really wrong, but when we define health, there are four components that we are concerned about, and they are your physical, your mental, your psychological, and social well-being. And so I'm going to define health in these with this component involved. Health is a state of physical, mental, social, and psychological well-being. It is not just the absence of physical illness. And so, because of this fact, when you go to see your doctor, he's concerned not only about your physical ill health, but he's concerned about your social, your psychological, and mental health. And so when we ask questions about your health, which we call history taking, we are concerned about the social well-being. You see what's going to your social life. You see what's going to your mental life, your psychological life. Because all of this has a role to play in your physical ill health or well-being. Now, what are you supposed to do as a patient when you come to see the doctor? You should tell your doctor everything that he needs to know. The reason is that if you do not tell your doctor everything that he needs to know, he's not a magician, he will miss some things that should help you gain good health. And so that is why you should tell your doctor everything that he needs to know. One of the things that you must do is you must be sincere. Do not come and tell us what age, official age or unofficial age. Tell us your real age, all right? And every information that we ask, it is not for anything. A doctor cannot divulge your information to anybody. So why are you actually hiding anything from the doctor? So you should tell your doctor everything that he needs to know because of the importance of the information you are giving to the diagnosis of your disease state. Now, after telling your doctor everything, we have about three assessment plan that we use in getting to know your well-being. One of them is history taking. The second one we do physical examination, and the last one we do investigation. And that is why telemedicine is gonna have problem with physical examination, but telemedicine can actually do both history taking and investigation. But physical examination, that's where telemedicine don't have problem, because that's another emerging medicine, telemedicine, where you can be far away and be seeing the doctor, and you can actually get treatment from it. But physical examination will be missing, which is part of the triple assessment for your health. Now, you have a role to play in your health. Do not overemphasize this. You have a role to play in your health. And what is this role that you need to play in your health? The role is being either compliant with whatever the doctor prescribes or adherent with whatever the doctor prescribed. At the time past, the main thing was compliance, where the doctor has given his prescription, you should go home and take the drugs. But in the recent time, what we are looking at is adherence. In this case, there is an understanding between the patient and the doctor, having done your history, your examination, your investigation, and a diagnosis has been made. A treatment plan is reached, and you discuss the treatment plan with the patient, and you agree on the need to take the drug. The patient goes home with the understanding of how important the drugs are, and it does not hide them. Now, there were a time that patients were given drugs, they hide them under the bushel, under the pillow, throw them away, and they don't take it. What does it do to you? If you actually have a disease that the drug will really help, the disease may kill you. We have what we call a natural history of disease. disease, natural history of disease, when you have a disease state and you do not have any intervention, how will the disease end? That's the natural history of the disease. Most time it may end in death. Sometimes the body can heal itself. All right. So, but it is important that we actually adhere to whatever decision we take when we, after taking proper assessment of our own health. This will help us have a good and stable health. If you are not informed, they say you are informed. I think if you follow me, if you subscribe, if you like my post, you will get more information that will keep you healthy in your workplace, in whatever you are doing. Please don't forget, no man who is sick can actually be productive in anything he's doing, no matter what you are doing, no matter who you are. You need sound health. We know small pains in the chest could mean a whole lot of things. Pain in your head could mean a whole lot of things. Pain in your leg could mean a whole lot of things. If you take it for granted, it's just like a car that is having small noise and you just take it for granted. Before you look, it stops you on the roadside and you have no mechanic to fix it. The car grounds you. So that's how your health is. Do not take anything, any symptom that you see in your body. You need to talk to a doctor so that a proper assessment will be done, and then the right information can be given to you and you have a good health from it.